Good morning, friends. In our clinical practice, we have noticed more often than not that patients come to us with symptoms of tremulousness of the hands, tremors of the hands, tremors of the body. As a psychiatrist, the common most condition is perhaps a panic attack or an anxiety attack. But such patients with tremors of hands can go to anybody. They can go to a neurophysician, they can go to a psychiatrist, they can go to a general physician, they can go to a general practitioner. So, what are the common conditions which we should normally think whenever we encounter a patient with tremors of hands? Common conditions, of course, are anxiety state, anxiety neurosis, panic attacks, phobic attacks. Then alcohol or sedative hypnotic withdrawal, benzodiazepine withdrawal. Many patients go to chemists, purchase benzodiazepines over the counter, antidepressants over the counter, and when the chemist sometimes refuses to give medications, these patients land up in the office of psychiatrist with tremors of hands, generalized anxiety disorder, hyperthyroidism, Graves' disease, in which we have the exophthalmos as one of the classical, apparent signs which we can notice the moment we have a look at the a patient. Then panic attacks, I told you, hypoglycemia, a diabetic, when he takes insulin or oral hypoglycemic medications, if he skips to take his meal or if he indulges in what's called as an overzealous exercise, he can slip into hypoglycemia. He can produce tremors of hands also. Pheochromocytoma, a tumor that also can present only with tremors of hands. We have something called an essential tremor, wherein also people can have tremors of hands. Whereas resting tremors noted, one Parkinsonism, other is Dravet syndrome. We have what's called as resting tremors in such conditions. We have what's called as an intention tremor. Which condition? One, cerebellar lesions. Number two, Wernicke's encephalopathy, which can occur as a consequence of chronic alcohol dependence syndrome. Are there any medication which can produce tremors? Yes. Divalprox, lithium, the commonest condition, the commonest medication which psychiatrists use for bipolar affective disorder. Patients can come 3 days or 4 days later after consuming medication with only severe tremulousness of hands. Carbamazepine, Tegretol, which we use for epilepsy, for trigeminal neuralgia, it also can present tremors of hand. Neuroleptics, which psychiatrists use for treating schizophrenia, they can. SSRI, antidepressants, fluoxetine, fluoxamine, blah blah blah. Nefazodone is notorious to cause tremors of hands. Venlafaxine. Stimulants like methylphenidate, dextroamphetamine, and cocaine, they are also notorious to produce tremors of hands. Caffeine, which is normally present in our nice drink coffee, sometimes caffeine can produce tremors of hands. Theophylline, you know, that the drug which we use for treating bronchial asthma, as a side effect, as an adverse effect, it can produce tremors of hands. Pseudoephedrine also can produce. Tricyclic antidepressants. What are they? Imipramine, amitriptyline, nortriptyline, protriptyline. Though the usage of tricyclics has come down, there are still some psychiatrists who prefer to use these medications also. They also can produce tremulous hands. Unlike MAO inhibitors, they do not produce tremulous of hands or tremors of hands. What are the MAO inhibitors? Iproniazid, nialamide, phenelzine. Of course, these medications have been almost obsolete in the day-to-day usage. Then, are there any other conditions which can produce tremors? Yes. Rubral lesions like Benedict syndrome with lesion of the midbrain tegmentum. Wing beating. In which condition we say wing beating? In some cases of Wilson's disease, we do note it. Flapping tremors, In hepatic encephalopathy, also in autism, we can notice these tremors effects. Though the commonest causative factor for tremors is phobia, anxiety state, but as psychiatrists, as a treating clinical physician, we need to remember all these causative factors. Thanks a lot for watching the video. Share it, like it. All the best. Thank you. God bless you.